not-for-profit providers of long-term care services for seniors in Iowa, including nursing facilities, hospital-based facilities, assisted living, residential care, home care, hospice, delivered meals, and senior housing. Our mission is to expand the world of aging, and we believe healthcare reform should include a provision for choice for Iowa seniors regarding where they receive services and from whom. It's important that we work together to be more flexible and creative and innovative as we strive to create new systems to create care for Iowa's frail seniors. We'd like to join the many other organizations here today who have expressed support for expansion of Medicaid. It's the right thing to do. It's the moral thing to do, and for many other reasons that have already been discussed today. We'd also like to talk about Iowa's proposal for an accountable care organization model for Medicaid. Iowa has applied for a CMS Innovations grant to implement an accountable care organization model in Medicaid. Because the initiative includes developing an ACO Medicaid payment arrangement under Wellmark's 2 ACO contracts, it is likely to significantly impact service availability for Iowa's Medicaid-eligible seniors and disabled and reimbursement for those providing services. Such a seismic change in healthcare delivery must include study of best practices, of how system development, taking the long view of how to best achieve reforms, then testing them in a pilot before statewide implementation. Seeking quick budget fixes misses long-term goals of achieving better systems and better patient outcomes. Also, it's unclear how adding an insurer with overhead and profit expectations between Medicare and Medicaid and providers will result in lower costs without harm to beneficiaries. Finally, managed care organizations should not have any financial incentives to restrict or deny care, including financial incentives for meeting performance targets. In addition, preserving access and quality, care delivery should be person-centered. It should include patient choice and responsibility. Core areas to focus on including all providers of an MCO network lists are actually available and accessible to enrollees, an emphasis on quality assurance and improvement, member education, and consumer rights. Also highly important are robust contractor oversight requirements. Risk sharing, there should be development of public payment program rules that create a level playing field so that aging service providers have the opportunity to share appropriate risks and rewards, as do hospitals. I'd like to also say that it's important that long-term care facilities be included, as physicians and hospitals have already been included in receiving dollars for the development for health information technology. If we are to work in a system of integrated services, we have to be able to share that health information through an integrated health information technology system, and there has been no money made available for long-term care providers. We appreciate this opportunity to speak. There's a wide variety of comments that we've heard today, so there's many issues to be resolved. Thank you.
Thank you, Dana, and I want to also just thank you for your service. I understand you are retiring at the end of this year, so we are sad to see you go. You've been a good leader for the nursing home and long-term care industry, and good luck to you. I just acknowledge the legislators who are here. Some have to go. Beth and Lisa have to take off for another obligation, but I want to extend my appreciation along with Senator Reagan, Senator McCoy, for all of your participation. Peggy Parker, and then Sue Huppert.
Good morning. I'm Peggy Parker. I'm the president of the Iowa Occupational Therapy Association. We are a professional organization. We represent the interests of occupational therapists. Can you hear me okay?
Yes.
Okay. She says no and you said yes, so we'll divide. There we go. Anyhow, what we do is we provide Our organization represents interests of occupational therapists. We provide education and advocacy for our clients. Currently, there's over 1,700 occupational therapy professionals and students within the state of Iowa. Occupational therapy is a science-based profession, and we serve people across the lifespan. We focus on individual performance needs by developing customized individual approaches to improve their independent functional skills. Occupational therapy allows Iowans to age in place safely. We also work with patients to return or remain in productive work, for students to learn and develop within their school and play activities, and also for people to participate within their communities. Our top 3 areas or priorities we'd really like you to consider is we support the state adopting definitions of habilitation services with the purposes of the essential health benefits and the Medicaid eligibility expansion, using the National Association of Insurance Commissioners' definition of that model. The second area is we support the expansion of Medicaid eligibility under the Affordable Care Act. This would expand access to health care services for tens of thousands of Iowans and will be mostly entirely paid for by the federal government. IOTA also supports the state engaging in an open access process to allow the stakeholders to have an opportunity for their comments and decisions. Currently, there are already barriers for Iowans to receive rehabilitative and habilitative services with their access to occupational therapy. They include rural access. There are a limited number of therapists within the rural areas. In the past, the state has eliminated the state higher level education program for occupational therapy. The state's restructured the area educational agencies and the administrative coordination of the therapists serving students in the public schools. The state has also limited reimbursement of occupational therapists in mental health. Without the inclusion of occupational therapy in the healthcare reform, Iowans will continue to experience further restrictions to access our essential holistic patient-centered care throughout their lives. Occupational therapists' services add years to people's life as well as life to their years. I want to thank you for hosting this forum today and allowing me the opportunity to speak on the behalf of occupational therapists.
Thank you, Peggy. Sue Huppert from Des Moines University, and on deck is Roxanne Cogil.
Good morning, and again, thank you very much for hosting this. All of the issues that we have, we need physicians. And the reason that I am here is because Des Moines University feels a strong commitment to placing physicians throughout the state of Iowa and encouraging our graduates to stay in Iowa. This could not happen without the work that many of you at the table provided last year when you passed the Rural Iowa Forgivable Loan Program. So first of all, Senator Hatch, Senator Reagan, thank you very much for your support in that. I did bring along a map so that all of you can see the commitment that we make to the state of Iowa, and it's by county. And I'd like to draw attention to Mitchell, Howard, and Floyd counties, the areas that Senator Reagan covers, and you can see the need that we have there for physicians. I remember meeting with you, Senator Reagan, last year, and we identified those 3 areas. So what we are trying to do is to encourage the governor to place in his budget $2 million this year to support the great work that all of you did last year in passing this. I also would like to quote a couple of our partners, the American Academy of Family Physicians and Iowa Medical Society, that you've also heard speak in behalf of funding that we are asking. But off the Iowa Medical Society webpage, it notes that at least 43% of Iowa's practicing physicians are over 50 years of age. So this is a workforce issue. It's definitely a healthcare issue. And we hope that if that $2 million does come through in the governor's budget, you would support it. And if it does not, that you would help us find the funding. So thank you very much.
Thank you, Sue. Roxanne, Cogil, and then Teresa Bonhoff.
Hello, I'm Roxanne Cogil, the Iowa Service Coordinator for the Epilepsy Foundation here in Iowa. Thank you for allowing me to speak today and for all the work that you folks do to improve health care in Iowa. The Epilepsy Foundation provides epilepsy education and support to over 30,000 Iowans who live with epilepsy, and this program is the only sustainable epilepsy service in the state and the only resource available to individuals' families needing epilepsy information and services, and significantly contributes to providing information, training, and educational materials to those who come in contact and work with people living with epilepsy. This program saves the state of Iowa thousands of dollars in preventing emergency room visits billable to Medicaid, preventing unemployment and underemployment in persons with epilepsy, and saving lives in persons with uncontrollable seizures. One of our initiatives is protecting patient access to epilepsy treatment and care. The goal with patient safety and medication switching is to ensure that epilepsy patients do not experience an increased risk of seizures. It is critical for epilepsy patients to have access to the exact drugs prescribed by their physician, ensuring seizure management success regardless of the drug's existence on the market, brand name or generic. Alternating between two versions of the same generic drug can even cause unexpected seizures. The Epilepsy Foundation supports the recommendations as determined and will be coming forth with their final report by the Iowa Epilepsy Treatment and Education Task Force. It is also important that access to seizure treatments and medications are available through Medicaid. Any existing barriers concerning access to seizure management medications need to be eliminated in order to increase care management rates and quality of life standards for people with epilepsy. In regards to the Health Benefits Exchange, as the state of Iowa prepares to develop and implement programs and services around national health care reform, it is essential that those with epilepsy be included. We are also in support of Medicaid expansion to cover the underinsured and the uninsured in Iowa. We are also in support of the mental health redesign, which is very much in need of adequate funding. So we are an advocate to get adequate funding for the mental health redesign. And we also support insurance coverage for all those Iowans in Iowa who are currently on the Iowa Cares to ensure that they don't go without insurance. Thank you for your time today.
Thank you, Roxanne. I'd just like to acknowledge Senator-elect Janet Peterson has joined us. Janet?
Hi, thank you very much for allowing me to address this distinguished group. I'm representing the Iowa Mental Health Planning Council in the NAMI Greater Des Moines, and my name is Teresa Bonhoff. I'm the chair of the council and vice president of NAMI Greater Des Moines. There's four, I know we were only supposed to have 3 health priorities, but of course I added a 4th. And I'm going to just briefly go through the four and then expand on them a little bit. The first is the implementation of Senate File 2315 Mental Health and Disability System Redesign will require adequate funding to be viable and enable us to move forward to build a system instead of going backwards. And this actually, adequate funding is 3 different parts, because in 2013, with transition funds that are needed, that needs to be addressed immediately to prevent present system failure and redesign failure. The second piece to adequate funding is expansion of Medicaid and the creation of a healthcare exchange for numerous reasons which I have listed. And the third piece is a commitment to a long-term funding formula that is not another frozen levy, so we can build a public mental health system as envisioned in Senate File 2315 instead of relying on the default system we presently have in corrections. The second priority is workforce capacity, and we hope that you will access training funds authorized in the Affordable Care Act. And on the workforce work group, we hope that family members and persons with lived experience can be full-fledged members of the work group rather than just interested parties. But anyway, there's 4 pieces to that too. One is on licensed professionals. I think there's cooperative educational ventures that could be made so that we have more than one training program in psychiatry. We have more than 2 training programs in psychology and for psychiatric nurse practitioners and physician assistants. The second one under workforce capacity is providers in regions. They have to be co-occurring capable, proficient in trauma-informed care, and use evidence-based treatments. And we need to support statewide training efforts to do that and authorize training costs to be direct expenses. The third part to workforce is the Peer Specialist Training Academy. For both family member and persons with lived experience, it should be established permanently and funded for initial and ongoing training support and employer training. And the fourth piece to workforce capacity is Direct Care Workforce Initiative. They've done a wonderful job with it, but the concerns of the Olmstead Task Force and persons with disabilities must be addressed and resolved prior to passage. And I've listed some of the concerns that I'm aware of anyway. So once again, it's adequate funding, workforce capacity, and the third one is mental illness, disability, and co-occurring education mandate to increase understanding, reduce discrimination, and encourage and facilitate early recognition and treatment. There's already been a mandate for mental illness training requirements for law enforcement. Okay, just a little bit. But we want to add also attorneys and judges, school staff and students, and medical schools. And the final one is restore open access to mental health meds. Thanks.